Hi, I'm Dr. Arif Rahman. I'm a consultant psychiatrist with over 10 years' experience as a consultant. I'd like to talk to you today a little bit about addiction. ADHD and addiction overlap significantly. Epidemiological studies have shown that the use of addiction or other coping strategies that people don't want to use is part of neurobehavioural disinhibition. In fact, when you do a brain scan of somebody with ADHD or addiction, it looks exactly the same. Addiction is essentially doing something that you feel the need that you have to do, but are resisting that need. It could be something as simple as looking at social media online for hours beyond what you want to. It could be gambling, it could be spending money that you don't want to spend. It could be also substances that are causing you harm. Essentially any sort of behaviour that when you don't do it you feel a distress and a craving to do it is addiction. And part of that is the management of neurobehavioural disinhibition. The emotional centres in the brain hijack the frontal lobe of the brain. Executive functioning is required to try and suppress that. The usual coping strategies that might be developed in a more positive nature over time through adolescence and through adulthood haven't formed. Quite often this is because of biological causes such as ADHD, and often it can be difficult to overcome these challenges if the ADHD is not overcome itself. I see a holistic approach as being the key. Of course, the behaviour itself is important, but what's the function of the behaviour? The function is often to try and avoid distress, and the distress could come from many areas. Feeling as if the relationship isn't working, not having satisfaction in the workplace, having difficulties with keeping in touch with people. Many experiments have shown that when people are put in a community and have connections, meaningful connections, that their addiction actually reduces significantly. So long as people are enjoying productive lives, having connections, feeling satisfied, then the use of one particular type of behaviour to cope with stress to the detriment of the person or against their own wishes and actual long-term goals, it simply wouldn't happen if we had a good quality of life. Now, I've got a lot of experience in addiction because obviously I've been the UK lead for young people's addiction services. Also, I've been the regional lead consultant for addiction services. But what I've found is the core to it all really is the overall mental health. That led me to ADHD as well, and I've developed significant expertise in that area, which you can see in some of the other videos. However, as a consultant, we're able to provide that holistic approach. So working with somebody around their behaviours that they want to reduce or stop isn't necessarily looking at that one behaviour and treating that. It's more about looking at the causes and the overall mental health well-being and psychology. Some of those things involve coaching and having a significant amount of training in psychotherapy. It's more than a medical approach, it's also a psychological approach. So motivational enhancement therapy, solution-focused therapy, and all of that built on the foundations of psychodynamic interpersonal psychotherapy, the use of metaphors, the use of appropriate goal setting, and making sure the goals are smart and achievable. Behavioural approaches such as graded exposure are very helpful. Substitution therapies, which can be medical, are also very, very helpful. But the key to it all is connecting with somebody, working with that person, and feeling understood by that person. It's the adrenaline storm caused by trying to resist a certain type of behaviour. That's the bit that makes you feel as if this is life or death. This is fight or flight. Really it isn't, most of the time. If you don't look at Facebook, or if you don't use social media for that hour, it wouldn't be the end of the world. If you turned off notifications, nothing catastrophic is going to happen. But in that moment, the emotional centres have hijacked all of the rest of your cognitive functioning. And what we need to do is work on strategies together to see how can we reduce that hijacking? How can we put, essentially, the chimp back in the box. If you are doing anything that you feel is perhaps a bit maladaptive, perhaps something you don't really want to be doing, if there's something that's impacting your life and could be affecting your relationship, and in extreme situations has got you in contact with, say, police or reduced access to your loved ones, then Clear Ahead Health is the best place to come.